In my research, I examine, as Karine already explained, discourses and practices of dementia prevention and care in German nursing homes in context of activating social and health policy, the medicalization of aging, and the economization of healthcare. I seek to understand how professional caregivers interpret knowledge about dementia and how they cope with the guiding principles of dementia prevention, treatment, and care in daily routine. Today, I will show how recent changes in the understanding of Alzheimer's disease shape public discourses and nursing debates on dementia in Germany. I will speak for about 30 minutes, and I'm very much looking forward to discuss my analysis with you afterwards. First, I will now provide a short overview of recent paradigmatic shifts in dementia research, and I put out some main characteristics of the German care regime. Then I will describe the methodological approach of the study. Finally, I present main results. I will show which concepts of prevention and care characterize German dementia discourses, and I will also indicate how the scientific knowledge is transferred into everyday knowledge of professional caregivers. I start with a very short overview of the widely discussed current developments in dementia research. Progress in the treatment of dementia has remained very limited in recent years. In the absence of effective pharmacological therapy options, the focus has shifted from treatment to prevention, as well as detection and prediction in very early disease stages. The focus on prevention and early detection is connected to a novel understanding of Alzheimer's. According to the new biological definition, Alzheimer's disease is not understood anymore as a clinical syndrome, but as a progressing pathological process that includes also pre-symptomatic and preclinical stages. In 2017, a Lancet report sparked a broad public discussion on dementia prevention. It is estimated that 40% of dementia cases could be prevented if 12 risk factors were better managed, which is indeed very good news. Most of the discussed risk factors, such as hypertension, obesity, hearing loss, or diabetes, are treatable. The preservation of cognitive abilities is therefore more and more understood as the outcome of efficient medical risk management and individual lifestyle choices. However, the causal relationship between risk factors and cognitive decline is not well established, and the actual effects of each preventive measure on dementia rates are still more or less disputed in medical research. Public health communication and media coverage regarding dementia nonetheless emphasizes the individual responsibility for dementia risk management. The increased focus on dementia prevention coincides with a change of broader cultural image of aging and a general trend towards individual risk management. Current gerontological approach emphasizes the plasticity of aging processes and highlight the activity and productivity potentials of aging persons. Prevention and activating care also have become central objectives of German care policy. The German Prevention Act, passed in 2015, engaged the care insurances to fund prevention and rehabilitation measures in care facilities more firmly. I will now present a few further specifics of the German nursing care system in order to be able to situate my analysis of discourses and practice of dementia prevention and care in Germany. In contrast to liberal or Nordic social democratic welfare states, the German care regime is traditionally strongly dependent on informal care given by family members. With the introduction of long-term care insurance in the mid-1990s, an increasing commodification, economization, and academization in the care sector in Germany has been initiated. However, despite an increasing formalization and the beginning academization of care professions, a considerable reduction in nursing staff has taken place, and almost half of the employees in German nursing facilities have no nursing training. In my study, I investigate whether and in what ways the change in the medical understanding of Alzheimer's disease affect dementia discourses and everyday care practice in context of these specific institutional and organizational contexts of the German care system. I therefore analyzed current German dementia discourses and conducted interviews with professional caregivers in different German care facilities. For the discourse analysis, I included widely distributed weekly magazines, newspapers, scientific journals, and online resources. The interview study is based on 20 problem-centered interviews with professional caregivers in 6 care facilities. Because of COVID-19, the interviews were conducted online and by phone. I now will present the main results of my analysis of dementia discourses and practice in medical science, nursing science, and media. In the section on nursing science, I also include some results of the interview study with nurses. In medical science, dementia is no longer seen only as a disease of old age. Understanding and diagnosing of Alzheimer's no longer focus on the clinical signs of cognitive decline, but rather on neuropathological change in the brain. The overall aim is to decelerate neurodegenerative processes as early as possible, before their actual relevance to everyday life. In addition to medical risk management, both environmental factors such as good education and individual lifestyle modifications, such as healthy diet and cognitive, physical, and social activities are stressed. The relevance of primary prevention and the treatment of risk factors is supported by reference to the following topics: the limited number of available therapeutic options, rising dementia rate as a result of demographic change, the burden on the healthcare system and economic follow-up costs, and, less dominantly though, the dementia-associated strains on patients and their relatives. This paradigmatic shift in dementia research corresponds with a change of the professional self-image and the role of physicians. Physicians are no longer seen as only responsible for treating manifest diseases. Instead, risk management and the support of lifestyle change in middle age are debated as additional responsibilities of medical professionals. Physicians should represent the role of advisors for successful aging for an informed and self-responsible patient. In particular, contributions focusing on concept of successful aging tend to understand patients as directly responsible for a proactive lifestyle and the prevention of health risks. In the journal The Neurologist, it is argued that a high degree of personal responsibility is required in primary prevention, which ultimately each person must take for him or herself. Consequently, patients are not seen as passive objects, but as managers and shapers of the risk, who can and should actively and preventively do something against dementia. The change in the medical understanding of dementia hence also changed the conception of what it means to be a patient. People are addressed as persons at risk or even patients long before symptoms like memory loss appear. As a result of this shift, also the line between cognitive health and disease is becoming increasingly blurred. In the nursing science discourse, three different rationales can be observed that revolve around the need to develop innovative approach in dementia care in Germany. The first underlying rationale is that the burden on the healthcare system and society should be reduced. This nursing science discourse is characterized by a strong focus on the burdens associated with dementia. It is, for example, argued that in times of mass aging, the growing number of people with cognitive disabilities will overwhelm the healthcare system. In light of the demographic change and the limited resources, innovative approaches in dementia care and dementia prevention are hoped to decrease the cost associated with the care of people suffering from dementia. This efficiency-oriented discourse is perceived but not embraced by the interviewed nurses. Increased efficiency is experienced by the nurses as a constraint, but it is mostly rejected as contradictory to their own nursing efforts. The two other rationalities or figures are reconstructed revolve around the idea of improving the individual quality of life of those suffering from dementia. One of this quality of life discourse is oriented around the guiding principles of self-determination and self-responsibility. The other is characterized by references to human dignity, personal needs, and relationships. Oriented toward the ideal of autonomy, some nursing approach first of all intend to strengthen the everyday competencies and personal responsibility of those in need of care. In this framework, it is emphasized that even already impaired patients have potentials for health promotion. A range of specific nursing interventions such as dancing, coordination exercise, and cognitive stimulation are recommended. The combination of cognitive and physical training is expected to effectively delay mental deterioration and maintain or even restore everyday skills. In some articles, the possible benefits of successful activating care are seen to be substantial. Nurses are seemingly considered to be directly responsible for maintaining the cognitive abilities of persons in need of care. Assuming a straightforward causal relationship between cognitive activity and cognitive health, it seems to be a question of good care, whether the patient's abilities deteriorate or recover. For nurses, this means that they must shift from an attitude of care towards an attitude of encouragement and support. In line with this scientific discourse on dementia prevention, one group of the interviewed nurses views healthy eating, exercise, and mental activity as very important for preventing or delaying dementia. Some nurses view dementia as a consequence of lifestyle choices in the earlier life and argue that the brain should be well trained because of the synapses, so that they have more connections, so that dementia can be delayed. In contrast to this activity and autonomy-oriented approach, the other quality of life discourse refers to the value of human dignity and thus primarily justifies nursing concepts that emphasize relationships, communication, closeness, and safety. In this context, nursing care approaches do not primarily aim to restore cognitive abilities or prevent further decline, but are oriented towards the immediate well-being of the persons in need of care. Good dementia care in this sense means, as stated in the journal The Nurse, perceiving the person in need of care in their unique personality and strengthening their emotional well-being. Nurses who are guided by this dignity-centered ethics tend to be rather skeptical about the effectiveness of dementia prevention. Furthermore, the impact of lifestyle factors on dementia risk is doubted, and dementia is still understood as an unpreventable and unpredictable fate. Asked about the possibility of dementia prevention, one nurse of this group states, I question how far you can really stop dementia. It is so often said now that people with cognitive impairments need to do memory training. I have a father who is getting dementia. My mother thinks you always must play with him to train his mind. But my father didn't play his whole life. He didn't play board games or card games. He hated them. Should this man now play cards just because he's old and has cognitive limitations? I think that's really bad. I don't think you should do that in the nursing homes either. This small narration and argumentation shows exemplary that caregivers who are oriented towards dignity and the immediate well-being of those in need of care have a rather critical views on activating intervention which aim to slow down the disease process. To sum up, German nursing science discourses on dementia are characterized by three different rationales. The first underlying rationale is that the burden on the healthcare system should be reduced by innovative care approach and the implementation of preventive measures. The second line of the approach is oriented around the guiding principles of self-determination and self-responsibility. The importance of dementia prevention and rehabilitation is emphasized to increase or maintain the autonomy of the dementia patients. Thirdly, nursing debates on good dementia care are characterized by reference to human dignity, personal needs, and relationships. It is astonishing that the autonomy-orientated and the dignity-orientated discourses hardly overlap. The examined different nursing journals can be assigned quite clearly to one of these two discourses structures. Above all, one can conclude that the new medical understanding of Alzheimer's disease does indeed influence German nursing science debates on dementia care. The idea of dementia prevention and rehabilitation seemingly plays an important role in care settings. Professional caregivers are called on to restore and maintain the cognitive abilities of persons in need of care, using specific mental and physical intervention. However, not all follow this pattern, and even fewer nurses seem to embrace the focus on prevention. I finally discuss the main characteristics of German media coverage on dementia. The German discourse is characterized by an even stronger and partly exclusive focus on individual behavioral prevention. One can reconstruct the following storylines that typically frame media coverage on dementia in Germany. First, media coverage on dementia is usually contextualized with references to demographic change and a prognosis of future dementia rates. Second, the suffering associated with dementia is portrayed. Headlines like "Forgetful, Aggressive, Confused, Experts Warn About the Dementia Republic of Germany" convey a degrading image of dementia and paint an alarming picture of the increase of cases in an aging population. Third, the findings regarding the impact of individual lifestyle choices are presented as a glimmer of hope against the background of the failure of recent drug trials. In this context, the readers are often addressed as being directly responsible for successful dementia prevention. Typical headlines such as "How to reduce your risk of Alzheimer's" convey the idea that successful dementia prevention is mostly a question of sufficient individual efforts and correct lifestyle choices. The advice focuses on a wide range of very specific measures like dancing, playing video games like Super Mario, or eating nuts. Headlines like "Study shows how many cups of coffee you have to drink to protect yourself from dementia" create the impression of conclusive causal relationships between individual living habits and dementia. In this context, existing uncertainties regarding the evidence for the effectiveness of individual preventive measures are not commonly mentioned. In addition, readers are occasionally called to contribute wherever possible, to the well-being of the community, as illustrated by the following example. Whoever takes on a social volunteer service or a voluntary position links the strain on the brain with a meaningful and thus fulfilling activity, a strong mental protection. Above all, the media discourse on dementia is focused on individual risk management. The burden the disease places on society and the lack of treatment options are used to emphasize the importance of dementia prevention through individual lifestyle change. People are strongly encouraged to adopt a healthy way of life to prevent or delay cognitive decline. In the following discussion, I place an analysis on dementia discourses with the critical debate on the implications of the paradigm of active and successful aging. Contemporary discourses on successful aging and the trend towards behavioral prevention have been problematized as a part of a general responsibilization of aging. The critique can be differentiated along the following key points: overextension of effectiveness of preventive measures, privatization of life risk, ideologization and stigmatization of old age frailty. The analysis of nursing science, medical science, and media discourses on dementia in Germany identifies some of these critical aspects, at least to some extent. Tendencies of overextension and specifically oversimplification can be found partly in nursing science and more distinctly in media discourses. The fact that numerous findings on the influence of individual prevention are still controversial is often neglected. Instead, a direct and strong causal relationship is often suggested between certain lifestyle choices and the personal dementia risk. In addition, the strong and partly exclusive focus on individual preventive measures might support a privatization of life risks. In German media, aging readers are called to shape their lives in a healthy and socially responsible manner. The political, economic, and social preconditions for active aging and dementia prevention tend to be neglected. For example, the big protective influence of education is discussed only occasionally in the examined discourses. In nursing science too, successful prevention seems to be understood foremost as a question of good nursing by individuals. External factors, as for example, the influence of the economic rationalization and rationing of care, are rarely considered. The call for dementia prevention further not only aims to improve individual health. Dementia prevention is not only portrayed as an individual opportunity, but implicitly also as a duty, and should relieve the burden on society. What could possibly be discussed as ideological embeddedness in the socio-political regime of the neoliberal welfare state. The fact that cognitive decline appears as a preventable disease could further lead to an increased stigmatization of both risky lifestyles and dementia itself. If successful dementia prevention appears a question of individual efforts, there is a danger of associating dementia with risky lifestyle and blaming the individual for cognitive decline. In interaction with the degrading image of dementia, the strong emphasis on individual responsibility might support victim blaming of those living with dementia and result in increased stigmatization, as Elizabeth Peel has put it. To sum up, in German dementia discourses, the preservation of cognitive ability tends to be discussed foremost as a question of individual lifestyle choices and personal responsibility. Protective factors such as education and the influence of the healthcare system are addressed only occasionally. Successful dementia prevention, as well as successful aging, are first and foremost perceived as a question of sufficient personal activity. Thank you very much, and I'm very much looking forward to your questions.